If you've ever had an irresistible craving that you just really couldn't ignore, whether it's to read a romance novel or check your phone or have another drink, you're going to really be interested in the interview I have. My guest today is Dr. Anna Lembke. She's the author of Dopamine Nation, which shows that the secret to finding balance is combining the science of desire with the wisdom of recovery. There's a lot of noise in healthcare and you are too busy for fads. I'm Dr. Vicki and this is Healthy Looks Great on You, a lifestyle medicine podcast, life tested, doctor approved. Well, thank you so much, Dr. Anna Lembke. I am so excited to share your wisdom and knowledge with our listeners. And I'd like for us to just hear a little bit about you.
Well, thank you for inviting me. I'm delighted to be here. I'm a psychiatrist. I'm on the faculty at the Stanford University School of Medicine. I have the sort of what's the classic academic job where I see patients, I teach undergraduates, medical students, residents, fellows, and I also do research. And my area of expertise is addiction, not just to substances, but also behaviors, things like sex, gambling, video games, social media, shopping, really, you name it.
Well, and that's where I first heard you, was speaking about addiction at the American College of Lifestyle Medicine conference. And the analogy and the visual picture that you gave of the role of dopamine was just so fascinating to me. I bought your book and read every word. And I'd like for you to just, if you could, summarize that for our listeners.
Sure. So I've developed this metaphor for capturing a very important concept in the neuroscience of addiction, which is the concept of homeostasis. So homeostasis is the sort of baseline states which an organism occupies and outside of which the organism is stressed. And so it's always the aim of all living organisms to return to their homeostatic baseline. And I represent this homeostasis by imagining that in our brain, in our reward pathway, there's a balance, like a sort of like a teeter-totter in a kid's playground, except that when it's at rest, it's level with the ground. And that represents how we process pleasure and pain. And pleasure and pain are co-located in the brain. So the same parts of the brain that process pleasure also process pain. So when we do something that's rewarding or pleasurable or reinforcing in some way, our pleasure-pain balance gets tipped to the side of pleasure, and that feels good. That releases typically dopamine in the nucleus accumbens, which is a key part of the reward pathway that's rich in these dopamine-releasing neurons. And when we experience pain, that pleasure-pain balance tips in the opposite direction. There are certain rules governing this balance, and the first and most important rule is that it wants to remain level with the ground, or again, what neuroscientists call homeostasis, such that with any deviation from neutrality, our brains will work very hard to restore a level balance. And the way that our brains do that is through a process called neuroadaptation, and specifically something called the opponent process mechanism. So I'll describe that. Let's say, like in my case, I eat a chocolate or read a romance novel. That releases dopamine in my reward pathway. That feels good. My pleasure-pain balance tilts to the side of pleasure. But my brain immediately goes into a stress response to try to get that level again through the process of neuroadaptation, for example, by involuting postsynaptic dopamine receptors to bring those dopamine levels back down to baseline. You can imagine that as these little neuroadaptation gremlins hopping on the pain side of the balance to bring it level again. But they like it on the balance, so they don't jump off as soon as it's level. They stay on until the balance is tilted an equal and opposite amount to the side of pain. That is the moment of wanting to have one more piece of chocolate or read one more chapter in my romance novel. And in more extreme examples, that's essentially the hangover or the come down or the blue Monday, right? That's the price we pay for that highly reinforcing substance or behavior. And then once we've had that come down, those gremlins, their job is done. They hop off the pain side of the balance. and the pain and the balance returns to a level position. But the point is that what goes up must come down, and that the harder that we press on the pleasure side, the more we will pay for it on the pain side of the balance before going back to homeostasis or a level balance. So that's the first rule governing this balance. The second rule governing the balance, which is really important for understanding what happens to our brain as we become addicted, is that with repeated exposure to the same or similar reward, that initial deviation to pleasure gets weaker and shorter in duration, but the after response to pain gets stronger and longer. You might imagine that as the gremlins lifting weights, and becoming Arnold Schwarzenegger gremlins, or multiplying so that all of a sudden now we have more and more gremlins on the pain side of the balance. And at some point, if we continue to consume our drug of choice over days to weeks to months to years, we don't get any deflection to the pleasure side. It's basically all just the gremlins reasserting their dominance on the pain side. And people will talk about that when they develop severe addiction, how over time their drug stops working. They need more and more to get the same effect. And at some point, it's not working at all they get is the negative from it. But they keep using because that drive to restore homeostasis is so fundamental that it drives people to continue their addictive behaviors, even if it's no longer pleasurable. And this is what people sometimes describe as wanting but not liking. So the motivation is there to pursue and get the drug, even though the drug itself is no longer conferring any kind of pleasurable reward. And that's essentially the addicted brain, right? Once we're in the addicted brain, we have gremlins, lots of them camped out on the pain side of the balance. And that's why people with severe addiction will relapse, even though they know objectively that their lives are better when they're not using. It's because they're walking around with a pleasure-pain balance that's tilted to the side of pain. They're in what we call a chronic dopamine deficit state, which is to say that their baseline levels of dopamine are below normal. And we have neuroimaging findings that show that if you compare the levels of dopamine in a healthy person's brain with a person who's gotten addicted to things like cocaine or alcohol or opioids, what you find is that the addicted person has below normal levels of dopamine transmission in the reward pathway, which is kind of counterintuitive, right? You might think, well, it might be higher, but no, in fact, their brain has had to adapt or compensate to this exogenous or external source of reward by downregulating its own endogenous or internal rewarding neurotransmitter, that is to say, the dopamine. Which is why the intervention most often when we treat addiction is actually to start with abstinence from the drug of choice. It sounds so obvious and simple, but sometimes we forget about that you need to abstain. We need to abstain, for long enough from our drug of choice for those gremlins to get the message that they need to now hop off the pain side of the balance so that homeostasis can be restored. In all honesty, it takes on the order of weeks to months, and in some cases, maybe even years, to fully get back to baseline. And in some cases, maybe people's brains, their pleasure pain balance might actually be broken, where they're not able, even with continued abstinence, to return to baseline homeostasis.
Well, that is absolutely fascinating. Each week on my podcast, I take my listeners to mini medical school, but today I think they got a more advanced version, and I think that's such a fascinating explanation of addiction because I don't think there is anyone I know who doesn't know someone who struggles with that. And the reality is, and you mentioned this, it's not just drugs. I think about screen addiction, and I think that's so incredibly prevalent. I wonder sometimes, like, am I checking email too much? I mean, why do I feel this need to look at my phone when I haven't gotten an alert, I haven't gotten a little buzz or anything else? And I think screens have somewhat kind of taken over our lives.
Oh, there's no doubt about it. You just look around and you see everybody buried, in a screen, even beyond what they want or beyond what's useful for accomplishing their goals of work or human connection. Like, we're clearly spending more time on the screens than we need to, or than even that we want to. The wanting without liking type of thing. And in all honesty, the screens are inherently addictive, and they were designed to be addictive. So they have many different features that make them addictive. Number one, the algorithms are by and large designed to optimize or push to the top of our feed stuff that we've liked before. And that's not that's not how real life is. Like real life is, you're going along in the world, you have to work really hard to find a little bit of reward. When you find it, you sort of gobble it up, but it's not very much. Then you have to keep going, and a lot of times you're not going to be able to find it, so it's unreliably rewarding. And there's a lot of hard stuff that you have to deal with along the way. Well, the internet and screens have totally inverted that phenomenon. Now we have an algorithm that specifically records and learns what we've liked before, and then actually pushes that to us. It feeds it to us for absolutely no effort, sitting on our couch, swiping right and swiping left. We now immediately get directly to our visual cortex and our auditory cortex, these very vivid, very potent images that are often, and moving images, right? And then short form video is even more potent because it's that fast offset, fast onset. So like the TikTok video equivalent, it's highly reinforcing for our brains. And now it's curated by this AI algorithm, to give us exactly what we want, but a little bit novel from what we had before. And all of that contributes to accelerating this addiction narrative, or telescoping. We sometimes refer to this as telescoping the addiction phenomenon, where we have so much access to all of this reinforcing stuff that we very quickly develop tolerance. Now we need to watch more or get more extreme versions of what we watched before for it to be rewarding. Plus, we're now very engaged in spending a lot of time doing that. And then, again, typically in nature, rewards run out, right? They're scarce, they're hard to find, and they don't last very long. You have screens and digital media, you've got infinite access to an infinite drug that never runs out, right? Our bottomless bowls, requiring almost no upfront work to get there. And you've got a very, very addictive kind of interface. And then you add to that the fact that, especially through this very social medium, you've got the likes, the comments, and shares, and all these different ways that we quantify our social validation. And we get a huge dopamine hit from social validation. We know that. We know that social validation activates the same part of the brain as drugs and alcohol. And now you've got a way to sort of mainline social validation, right? So it becomes, a very, very intoxicating experience that can be hard to moderate.
Wow. And I think it affects all of the pillars of lifestyle medicine. It can keep you from getting out and being physically active. It can certainly interfere with your sleep if you're scrolling all night instead of getting the rest you need. It can interfere with your social life because you're not making real connections. And we all know that there's more anxiety and depression associated with just mindless scrolling. And then the other pillar is substances that are harmful. And so, where is the hope?
Well, there's always hope. There's always hope. And what I think is so exciting is that for the first, specifically thinking about screens, I mean, for the first 20 years of the existence of the internet, digital devices, digital mobile devices, smartphones, we were only talking about how incredible it is and how every baby should have their own iPad and every kid should have a smartwatch or what have you. I'm delighted that at least in the past 5 years, there's now a national conversation about the harms, which we just simply cannot ignore. It doesn't mean that we don't acknowledge the good things, because there are good things, but we have got to acknowledge the harms, and we've got to really do a cost-benefit analysis, right? Do the good things outweigh the harms or not, and in which populations? And I think the population that we can, that for which there's a growing body of evidence and I think growing consensus, that kids are a vulnerable group, and that We really, kids, certainly under the age of 13, should not have unfettered access to the internet, or possibly any access to the internet. And that kids between the ages of 13 and 18 need a lot of guidelines, guardrails, help managing their consumption. And as I've been saying for many years now, but there's now more traction in these areas, we should get smartphones out of K through 12 schools. There are schools that are doing that now as top-down policy. So not just during class, but during breaks, during lunches. And what they're saying about these schools is that they're noisy again, right? Because kids are talking to each other, right? They were like tombs before, because kids were just all on their phones and not socializing and not interacting. So that's a very hopeful direction. Has been a lot of legislation in the past 5 years at the state level, around just do exactly what I'm talking about, getting smartphones out of schools, but also limiting kids' access to things like pornography websites and even certain social media websites. So this is, I think, important progress. And there's always this worry. It's kind of like this whack-a-mole effect. Well, if it's not drugs and alcohol, it's the internet, video games, social media, pornography, and it's not that, then it's something else. And I mean, to some extent, we do see that phenomenon, but I think what needs to be acknowledged is that one of the biggest risk factors for any addictive disorder is simple access to the drug. And we're living in a time and place where we have incredible access to so many drugs, traditional drugs, including alcohol, plus these drugs that didn't exist before, these digital drugs. So I think we really need to acknowledge that access is a huge problem in the modern world, as well as the ways in which technology has aided access and made these drugs more potent and made new drugs that didn't exist before. And, there's a lot of great things about technology, but there's a point at which the good things actually don't outweigh the bad things. And I think we're at that tipping point.
Well, that is such useful information, and I think that just having conversations like this are helpful. I know that in my state, some of those laws have been enacted, and I've seen the conversations, and this kind of gives me a perspective that I think is based in science, and it's urgent. It's urgent that we have these conversations and talk about these things, because it can be extremely dangerous. So I really appreciate you taking time to come and talk about this so that we can increase awareness.
Oh my gosh, my pleasure. Thank you for giving me the opportunity.
That was such wonderful information. And as I mentioned before, I always take my listeners to mini medical school on the Healthy Looks Great on You podcast. But today I think you went to a more advanced session on neuroscience and neurochemistry and how dopamine affects our brains. And I will put a link to Dr. Anna Lembke's book, Dopamine Nation, in the show notes. You will want to get a copy of this and read it. I have read it, highlighted it, underlined several things. I think I'll read it again after this fantastic conversation. And if you enjoyed this podcast, I hope you'll hop on over to Apple and leave a review or share it with your friends. The information contained in this podcast is for educational purposes only and is not considered to be a substitute for medical advice. You should continue to follow up with your physician or healthcare provider and take medication as prescribed. Though the information in this podcast is evidence-based, new research may develop and recommendations may change.